Greetings and very good afternoon. Today my special guest is Tina Spirum, and she's the thyroid dietitian. So you can guess what we're going to be speaking about. Lots of issues. I read some staggering statistics that there are, let me just check, 14 million Americans affected by various diseases with their thyroid, and so we're going to be discussing those rather horrendous numbers with Tina. If you have any questions, any sort of comments that you'd like to make, please do go ahead and make them, and I'll put the questions forward to Tina and you'll have answers. So a wonderful opportunity for you to do that. Thank you for being tuned into RIK Classic and to Saskia Unreserved. And that was Rachmaninoff and his Caprice Opus 18. A reminder, you're tuned into RIK Classic. We're coming to you live from the 4th radio channel, and we're also now streaming live on Facebook with my very special guest today, Tina Spirum, the thyroid dietitian. Thank you so much for being here in the studio with me. It's a privilege to have you.
Thank you very much, Saskia, and I just wanted to say a quick congratulations on your book. That's very exciting
Thank
news.
you so much. Thank you, thank you.
And thank you so much for having me here to talk about a subject I'm very passionate about.
It's obviously come about from a lot of personal struggle, which makes it just so much more poignant. Your struggle with Hashimoto's, which led to your incorporation of different practices for your patients. Tell us a little more about Hashimoto's, also known as chronic lymphocytic thyroiditis.
Sure. Hashimoto's is basically the name given to the autoimmune condition which attacks the thyroid gland, rendering it to be underactive and getting to the point where you can become hypothyroid. What a lot of people don't know is that having the antibodies against the thyroid, they can exist in your system 15 years before any issues with the thyroid start to appear. So I think that testing for antibodies can be a great way to kind of be preventative towards your thyroid health. And a lot of the time, a lot of people think that Hashimoto's is a thyroid issue, which effectively it's an immune issue. It's showing your immune system issue.
Tell us about the difference.
Yes. So when you have things like, in order for you to, let's put it this way, a very well-acclaimed doctor in the United States working out of Boston, his name is Dr. Alessio Fasano. He found that you need 3 things in order to get an autoimmune condition. The one thing is a leaky gut, and we can talk more about that.
Mm-hmm.
The second thing is a genetic predisposition, so having a family history of it can lead you to having an autoimmune condition. And the third thing is a trigger, and the trigger can be anything within the environment. It can be from your food, it can be from toxins within the environment, it could be from a traumatic experience, it could be from anything that you're exposed to.
This sounds also quite similar to cancer cells.
Yeah, can be. Can do, yeah.
That have those same 3 categories.
Yes, yes.
Right.
So having this predisposition means that the difference between the actual thyroid problem and the autoimmune issue is that the autoimmune issue, you can build antibodies, like we said, 15 years before the thyroid is starting to show signs of underactivity.
Yes.
So in effect, if we control the immune system or balance the immune system, we can avoid any thyroid problem.
If it's that simple, why is it that we have these horrendous numbers? And the stats that I have are from July of 2018, that 14 million people are affected in the USA. Those are horrendous numbers.
Yeah, and from my experience as a clinician, as a nutritionist, and now a functional medicine practitioner, I believe that those numbers are severely underreported as well. There was a study done a few years ago, and they looked at women that have passed away, and in their autopsies they found that 30% of these women had autoimmune thyroiditis in their lifetime and never knew about it. And these reports also show us that there's been a drastic increase in these autoimmune conditions over the past 50 years. And what we're looking at functional medicine is that the difference that we see in conventional medicine, usually you'll go to your doctor, you'll say, you know, I feel cold all the time, I'm tired all the time, my hair is falling out, I'm gaining weight, I don't know what's wrong with me, I'm just not feeling well. And the doctor will check something called thyroid stimulating hormone, your TSH.
Yes.
And first of all the way from 2002, the TSH, the normal TSH, the functional TSH, has been reported to be between 1 and 2.5, or even 0.5 between 2. And this has been in the scientific literature. But even until now, doctors are seeing like a TSH of 4.5 or 3.5 and saying, no, you're completely normal, there's nothing wrong with you.
Why is that?
Just not knowing enough about the thyroid condition.
Oh, Tina, you're going to have a lot of opposition from doctors.
Well, they can't refute me because it's all in the science. It's all in the literature. There's nothing they can't say against that. And if you more and more endocrinologists that are really looking into it are agreeing with me. And it's not just about TSH. There's also, you have to look at free T4 and your free T3. Your T4 hormone is how much free storage form of thyroid hormone you have.
Yes.
And your T3 hormone is how much active form of thyroid hormone you have. What that means is that the T3 is actually the one that gets into the cell and is used to metabolize all the different functions of the body. Just to let you know, every single cell in our body needs thyroid hormone to function. That's how important the thyroid is to, it's an integral part of the mechanism to metabolism.
Yes. So that's obviously probably the first step that you go to the minute anybody comes to you. I guess most people come to you and say, I'm gaining weight. And then they say, right, off, for your thyroid testing. If the thyroid results come back and a doctor or dietitian is not aware of the parameters and the numbers or the updated stats as you've described them, they're in trouble.
Yeah, because the patients can leave feeling very deflated and frustrated because, you don't...
You know that there's something wrong,
right.
But nobody's able to actually fix it. I believe that it's not curable. Hashimoto's is not curable.
There's not a cure. There's not a cure. However, you can live symptom-free. That's the hope. Okay? So we can put the body back into balance. Once the body knows how to attack itself, it will always know how to attack itself. So, for example, if you've acquired a state of being in a symptom-free state and living a high quality of life, and then you get a divorce or you lose a family member, those things trigger the body to start attacking itself again. So it's not 100% ever. But what the journey tells you in terms of finding health with thyroid disease is really allowing yourself to get to know your body, how your body interacts with your environment and your diets and all those things that we're doing to our bodies, and to be aware of oneself. So an example I can give is, which is very common with women, is our ability to say no, putting those boundaries. Okay, so if we're saying yes to everybody all the time, we're always saying no to ourselves, and that can wreak havoc on our health and also cause our body to further attack itself. So
you're very right.
Of the many
but
examples.
It just takes quite a long time. I wish it hadn't taken me that long to put my foot down, but it did take quite a long time. Hopefully the next generations will be faster. And you have a very valid point as far as stress is concerned. It's often reiterated, I think only just last week, that I had Dr. George Migalidis, the psychiatrist, and he said that the stress is a killer.
Yeah, number one killer. I would attest to that. I think that I talk a lot. I'm also an autoimmune paleo certified coach, and one of the things that we do talk about quite often with my patients is stress. And so when people come in and say, oh, it's just stress, I'm like, yes, it's not just stress. We really need to address that. We really need to see how we can cope with that stress or maintain it or decrease it, and also talk about things like better sleep, better nutrition, getting the right nutrients in the body to help with that stress.
This Hashimoto's is not something that actually can be left. It's actually a fatal disease, can cause a coma and heart problems.
If left unnoticed for a very long time, that's the extreme of what can happen, of course, yeah.
Right. What are some of the other dangers of having Hashimoto's?
Well, when we have, because it's an immune system issue, when you have one autoimmune disease and you're not really paying attention to it, you have a very bad diet, you're under a lot of stress, you smoke, you don't exercise, okay, if just left unnoticed, it can cause other autoimmune diseases. So having one can be susceptible to many, such as, it really depends on your genetics, how your body will express them, but any other kind of autoimmune disease, such as celiac disease, such as ulcerative colitis, such as Crohn's disease, such as psoriasis, eczema, hair loss, those patches of hair loss, multiple sclerosis. All these things are autoimmune conditions, and lupus. All these things can occur if you're not really taking care of yourself.
What would you say, from your experience, is the best treatment?
Well, this is why I love what I'm studying right now, which is called functional medicine. Functional medicine differs from conventional medicine in that we look at the patient holistically. A lot of the time, I'm not saying that conventional medicine sucks or we shouldn't even, bother with it.
Yes.
Because conventional medicine is awesome at saving our lives acutely. Like, you have a heart attack, they know how to deal with you to save your life. Yes.
Because it's terribly important, I think, not to just disregard conventional medicine. Many people who begin to practice holistic medicine or turn to herbs completely disregard conventional medicine, and that's, I feel, very dangerous.
No, my theory is we need everything.
Right.
And, although conventional medicine has really done a lot for us as a human race to really feel better in the short term, I feel that it falls short of treating patients in the long term. And this is where integrative medicine comes in, looking at the patient holistically, looking at the patient, a lot of the time people that practice in conventional medicine model, they just don't have the time to look at the patient holistically. But this is where working with each other as practitioners can really help the patient. So for example, if a conventional medicine practitioner is aware of how important diet is with someone that has autoimmune disease, they can easily say, well, okay, I have a nutritionist I want you to go to, and I'm going to be checking in with her too to see how your progress is going. So with one sentence already, you've already helped that patient a little bit more. And so holistically, what we look at the patient's stress levels, we look at what they've been through in their lives, we look at, even as far back, I'll ask, if the patient knows when your mother was pregnant with you, was she stressed out? Plays a big role. Were you born naturally? When you were a child, did you have a lot of ear infections, or were you a colicky baby? Did you take a lot of antibiotics? All these things kind of lead up to where we see disease form. And usually when you ask a patient, what is the moment you have that you've never been well since? And a lot of people can track it back to an experience and say, you know what, I just lost my dad 4 years ago and my health problems started since then. So it's really...
Does that help you to define the road and the path that needs to be taken?
Sure, it gives me a lot of insight. Gives me a lot of insight into what needs to be done. So for example, if a baby was born... if you were born by cesarean section, you're not getting all the good bacteria that you would have if you were born naturally. if you were not breastfed and you're a very colicky baby, that can be the beginning of intestinal issues later on in your life. And so all these things give you a much more concise and clearer picture of what's going on with the person so that you can help them holistically.
Have you got research to back up, for example, the comments about cesarean births?
I'm sure there is. I haven't looked up any recently, but I know from colleagues that have talked about this that there is some research out there. So I can look it up for you and kind of post it on your page later for people.
Right.
Yeah.
How does diet rectify or at least maintain the symptoms of Hashimoto's?
Well, it's amazing how old wisdom from 3,000 years ago is only starting to be slowly uncovered today. Hippocrates said that all disease begins in the gut. And when we're talking about the immune system, 80% of the immune system is surrounding the intestines. And so if we think about that, it's a really smart mechanism. What's happening is that right outside of the intestines, we have soldiers waiting. So that if anything weird comes through those intestines into the bloodstream, those soldiers are ready to attack and get rid of and clear out. Okay? And so I mentioned before that one of the things that we need in order to develop an autoimmune disorder is a leaky gut.
Yes.
And basically what that means is that it doesn't mean, like, don't envision like someone being in the toilet for a day. That's not what a leaky gut is. A leaky gut means that the intestinal wall, one of the functions of the intestinal wall is to keep what we need to keep inside of the intestine, which can live perfectly in harmony inside of the intestine,
Yes.
from getting into the bloodstream.
Yes,
So that's
exactly.
one of the functions. And
Yes.
these little guys that do that are called, or these doors that do that are called tight junctions. Okay? And with stress, with certain foods like gluten, with bacterial infections, parasitic infections, fungal infections, a whole slew of stuff, okay?
Yes.
These tight junctions can be compromised, okay? And now all of a sudden, your gut becomes leaky, and things that normally wouldn't
Should be
enter into the
contained.
bloodstream
Yes, I
will start
understand.
entering. And now if this happens day after day, week after week, month after month, year after year,
I can imagine.
the immune system starts getting very confused and starts attacking the body itself. So in this case, it would be the thyroid, right? And so where diet plays a role is that we're seeing lots and lots of research that shows us that by eating specific kinds of foods and avoiding inflammation-causing foods,
Yes.
we can actually help to heal the gut and close up those tight junctions so that
Is it? Sorry to interrupt
Yes.
you, but I'm. You've created a picture in my mind. So I just see the intestinal wall. Do these what mini ruptures? Would you call them that? Are they able to close again
yes, they are,
Right.
with the right ingredients.
with the right
For sure.
ingredients? We've had a lot of questions, which I'd like you to answer from our Facebook, from Melanie Nicolau, who says, I'd like to hear Tina's views on MS and nutrition, multiple sclerosis.
Multiple sclerosis. You can look up a brilliant doctor. Her name is Dr. Terry Walls, and she actually was wheelchair ridden for many years, and she was a trained medical doctor, and the medication just wasn't working. She was getting progressively worse. And she found through her own research and created her own protocol through diet that now she's running triathlons. Like, the woman is amazing. And she
Wow.
travels the world lecturing on how diets can help, on her way, can help with how to improve multiple sclerosis.
If it's that simple, why has this not come about before? Why were we not able to help Jacqueline Dupre, concert cellist, and we lost her just far too soon, and so many other people?
I think just the lack of knowledge and lack of research, because a lot of the time there's not enough money to fund research about food, and also those studies are very expensive and very hard to undertake, because you're talking about being in a very controlled environment when it comes to what somebody's ingesting. And also, it's very hard to, diet is one of the main parts of helping people, but there's also other lifestyle changes. It's a lot more complex,
Yes.
it's diet, it's sleep, it's your, I know a patient that her ulcerative colitis is just fine until she gets stressed out. Like there's an immediate mind, body, spirit connection right there.
Oh, that's I completely understand. I mean, somebody, yes, you can walk down a corridor and you can have toxicity coming at you from all angles, and
Exactly.
you feel instantaneous headache, pain in your stomach. I totally get that. Another question was, do you know of Dr. Walla protocol diet for autoimmune diseases?
Dr. Walls? I think
Yes.
that's the doctor I just mentioned. Yes. Yeah.
Walls. Yes,
Yes.
there was a typing error. And your opinion. So there you've got the answer, Melanie. I wanted to discuss nutrition in general. Gluten-free, sugar-free, meat-free, hormone-free, dairy-free, everything so free. In the end, I'm thinking we're going to just pop a plastic pill.
At the end of the day, yeah, it becomes extremely confusing, and this is where
I'm laughing because I actually saw something, and I actually bought it because I thought, what on earth is this going to taste like? And it tasted like nothing. I think it was some cracker,
Okay.
but it had all those. Everything was free.
Yeah, I mean, this is where I can definitely understand people and their confusion, because we've kind of been taught as a society that there's this magic bullet, that there's this magic diet that will instantaneously make you better. But what I've seen in my 20 years of experience as a nutritionist is that, and functional medicine confirms it for me,
Yes.
we look at bio-individuality. And what that means is that for everybody, for every individual at specific times in their lives, what they're eating changes in terms of what will help them with their health. Okay, we can say some general things right now for autoimmune
Please.
disease.
Yes.
Yes. But it's very important to work with somebody that knows about this stuff to kind of guide you through what you need to be doing in terms of health.
So in fact, you could have started eating tomatoes when you were 5, and when you got to 15, tomatoes didn't work anymore.
Right.
Okay.
Right. Or the opposite, like once we start healing the gut, I mean, this is the ultimate goal. Once we start healing the gut, we want to get the person to a level where they're eating practically everything. But when I say everything, I don't mean junk food. I mean
Yes.
from real food.
All right. So tell us.
Yes.
Let's break it down into smaller bites.
Sure. All right. So typically when I have a person that comes in with Hashimoto's thyroiditis, okay, what I'll have them do for 6 weeks is go on an anti-inflammatory diet protocol. And what this entails for me is gluten-free, dairy-free, and sugar-free. Okay?
Oh my goodness! Is there anything left to eat?
Lots of stuff. This is where people get confused.
Wow. I just hear the sugar-free at the end, and my heart is starting. That's causing my stress.
Well, I mean, I still have people eat a little bit of honey if they want, or have a little bit of maple syrup. That's okay, a little bit.
All right.
But what we're meaning by, and junk-free, so
Yes.
processed diet out the window, okay?
Right.
Now, when I say gluten-free, I don't mean go to the supermarket and go and buy all the gluten-free cookies there are.
Yes.
That's a lot of processed additives that are adding toxicity to our bodies. I mean going gluten-free and looking at real food-based options. And just as important as the stuff we take out, probably even more important, is the stuff we're putting back in, okay? So every time we eat, we can envision the colors of the rainbow. Do we have that much color on our plate? Okay, so a lot of
Okay.
people will say, I had some lettuce. Okay, well, lettuce is green.
Yes.
What about putting some tomato? That's red. What
Yes.
about putting some cabbage? That's purple. What about putting some pepper? That's orange. So all of a sudden, in that plate, the more color you have, the more phytonutrients you have. And these phytonutrients, there's thousands of them being uncovered now in research, are really the ones that help the body to heal and help the gut to get back into better health. Okay.
It's interesting that you've said this fascinating subject. I'm so glad that you're here. That you're going to eat, for example, maybe some cabbage, and I'm already thinking, isn't that going to actually aggravate the stomach lining and cause bloating?
In some people, yes. In some people, no. It depends how healthy their bowels are. So people with irritable bowel syndrome, for example,
Yes.
they typically say that, cabbage bothers me.
Yes.
But it's also wise to say that about 84% of people that have irritable bowel syndrome, their main cause or their root cause is something called SIBO, which is small intestinal bacterial overgrowth. And that just simply means that bacteria that exists happily in the large intestine has moved up to the small intestine and is causing all the symptoms of IBS. So if that problem is dealt with either herbally or with a specific antibiotic, all of a sudden you can start eating cabbage and you're fine.
Right. You said gluten, dairy, and sugar-free. Dairy. One person says yes to milk, the other one says no. One says have rice milk, the other one says soy. No, soy's not good. Where are we? You understand why
Yes,
people
it's very confusing,
are
yeah.
so confused?
Yeah, I mean, the thing is with an elimination diet is that we are trying to get your gut to a better state of health and to find out this journey of what really works for you as an individual. So I have many people reintroduce all the way up to most dairy products, but let me then state organic dairy products, okay, higher quality dairy products,
Yes.
and they're completely okay. It doesn't bother them. And so what we're trying to do with the elimination diet is just giving the intestines some time off to kind of not have that state of inflammation going on.
Yes.
And then what we do after that phase, it can be from 6 weeks until 6 months. It depends on how serious the situation is with the patient. After that, we start adding back each food one by one and have this person be very aware of symptoms. I think it's important to say here the difference between a food allergy and a food intolerance.
Yes. Tell
Or
us.
food sensitivity. A food allergy, just think of it as it happens immediately. As soon as you eat something, you start itching, you can't breathe properly, you're not feeling right. Okay,
Yes.
and it can be deadly. So that's an allergy. An intolerance or a sensitivity can happen 3 days after or 4 days after you've ingested a food. So, for example, you may eat 2 slices of bread after reintroducing it on a Monday, and on Thursday have a splitting headache. Okay, so it takes some time to understand what's going on with a food sensitivity.
I think that the majority of people cheat on their diets. Have you found that to be true? And if they do, how do you actually deal with it?
I think it's important to leave out words like cheating and diet and kind of look at it as an experience and a journey into getting back to better health. I think it's much more healthy to think of it like that. So when people say, oh, Tina, I couldn't stay gluten-free for the 6 weeks and at 4 weeks I had some bread.
Yes, yes.
My thing is I'm going to say, okay, great. What did you feel afterwards? Did you feel any symptoms? And a lot of the time they'll click and say, as soon as I ate it, I got brain fog, like I couldn't think clearly. I lost my concentration. I'm like, okay, so great. We see that it is bothering you, just keep going. Okay, so it's not a black or white thing.
Yes.
We really, the goal is to have people ultimately make it a lifestyle for themselves, that they understand their bodies, and when they do eat foods that, let's say, they're not supposed to know how to react to that and to know how to deal with it. You can even take things like let's say you're very sensitive to gluten or dairy and you happen to ingest some by mistake. You can actually take some enzymes or some activated charcoal right afterwards, and it helps to kind of bind to those things and flush them out of your system before they start bothering you.
Right. You mentioned organic. I think many people have a problem with the price of organic. Yes. How does one deal with that?
Well, I do see that there is a need for changing how things are done a little bit. It's not only in Cyprus, it's worldwide. People are paying the price for eating real food. But at the same time, what we can do is, if we kind of put together all the money we're spending on junk and not eat that junk and invest it in the food that is better for us, already we can manage to have some sort of a budget for some organic foods. So when it comes to fruits and vegetables, we can actually look at a a list that's made every year of the Dirty Dozen and the Clean 15. So these are the vegetables and fruits that are the most exposed to toxins versus the more cleaner fruits and vegetables. It comes out every year from the Environmental Working Group. You can find their website and look it up. And basically what I tell people when they do get their vegetables, if it's not organic, to have them soak it in water and a little bit of vinegar. Usually does the trick.
Right.
Yeah.
What happens in Cyprus where, I mean, you can buy your vegetables on the corner and somebody says, well, they're organic.
Well, we don't know that. We don't know that for sure, do we?
No.
Yeah.
How does one know that it's organic and that it really is?
Well, there are some farms in Cyprus that are certified organic. Like you have to, and that's why it's expensive, because to get that licensing, it is expensive to pay for that every year as a company. And so there are some farms in Cyprus that have started doing that, and you can go to these farms and buy directly from them or have them delivered directly to you. So that movement is starting in Cyprus.
Hydroponics and the growing of your vegetables like that, would you advocate that that's a good method?
Well, I mean, I'm not sure. I don't have much knowledge in the area. It's something I have to look into further. But from an educated guess, I would say that if we need to be using soil to grow our foods and to get cleaner soil, because that soil is the rich source of iron, magnesium, selenium, zinc, all your minerals. And these depleted soils have seen us having like not so nice symptoms like magnesium deficiency. One of our lecturers, he's a naturopath in the United States, he said he did his own study of his patients of 4,000 people, and out of 4,000 people he tested magnesium levels. Only 45 were not deficient in magnesium out of 4,000 people.
Wow.
So he said it's safe to say that most people are going to need a supplementation.
Talking about that, is there any way that we can avoid vitamins and supplements? And how good are they? And how do we know what's actually gone into them?
Yeah.
Because there's so many brands, and I just look at them and I see, well, one's 30 euros, one's 50 euros, one's 2 euros. Oh, that one maybe. And you see, when you actually go and see the contents, they're basically the same.
Right.
So what makes one 2 and what makes one 50? And I've just taken arbitrary numbers.
Well, that's a very good question. I mean, a lot of people say, why do you need supplements if you're eating an already nutrient-dense diet? And the answer is that think about one day. One day of stress increases your nutrient necessities up to 300%. One day of stress. So if you've already gotten to the point where you have a chronic disease, that your body is so inflamed, okay, you would have to be eating all day long and all night long to get those nutrients inside of your body. So supplementation is not something that you'll necessarily have to do for a lifetime, but when it comes to relieving a lot of the symptoms in the short term and getting you to a state of better health so that you're able to eat a more nutrient-dense diet, I definitely believe that there's a place for them and that they're warranted. And an example would be someone that has irritable bowel syndrome. Many patients with Hashimoto's have issues with their gut. I would say 9 out of 10. So the first thing I give them is some digestive enzymes to help them to break down their food better so that it can get better absorbed, so they're getting more nutrient density into their cells to begin with.
Do these work very quickly, and do patients see immediate results? Because I feel that there's also that sense of impatience. We're moving in a very fast world from many perspectives, and I think that's another case. People lack the patience.
Yeah.
Me being one of them.
Yeah. I mean, lots of people can see results fairly quickly. Like within 2 weeks, they can start saying, I'm not as bloated. I'm not getting as much reflux as I was. The symptom relief can start pretty quickly, and that's really good news, because in a fairly cheap way, we're just giving a supplement of enzymes, and that person is able to digest their food better. So that's one of the things that we can give. For example, if someone has issues with reflux, a lot of people don't know that by taking masticha, which is natural to our Greek community, masticha in capsules, for example, so we have a nice higher dose, you can relieve things things like H. pylori, which is a cause of gastritis, is a bacteria, if it overgrows, is a cause of gastritis. And we can relieve all those symptoms of heartburn just by taking something natural. So this is something where supplements are warranted and can give people relief and make them feel better without the symptoms of some pharmaceuticals, for example.
What about the paleo diet?
Well, the paleo diet, as I mentioned before, I'm an autoimmune paleo certified coach.
Yes.
And basically what that means is that the autoimmune paleo diet was formulated by Dr. Sarah Ballantyne, who was a medical researcher. And in her time off to raise her kids, she wrote a textbook.
As one does.
Yeah, as one does, yes. And she basically looked at all the different foods and how they affect the immune system. And with an autoimmune condition, the key word is balance. You don't want to trigger the immune system.
Right.
You want to balance it. So she looked at how foods either balanced or triggered the immune system. And again, what it is, the autoimmune paleo lifestyle is just that. It's a journey. So we start off with the elimination diet, which seems quite strict. Okay,
yes.
So we start off by eliminating a whole bunch of foods. Because there's so many, I'll just say what you can eat.
Yes.
What you can eat are,
yes.
are organic meat, chicken, fish, and seafood.
Yes.
And vegetables, excluding the nightshade vegetables. So that's, your tomatoes, potatoes, eggplants, goji berries, all those.
You exclude those?
You exclude those, yeah. And
potatoes are excluded?
Yes.
Right.
In the first phase. Okay?
Right.
So after about that 6-week period or longer, depending on how ill the patient is, we start adding back. So we can start adding back your seeds and your nuts and your spices that don't stimulate that before may have stimulated you, but now are not, because
yes.
you gave that time for your gut to heal.
Yes.
And the autoimmune paleo lifestyle also talks about improving your sleep, improving your hygiene, improving your environment around you. Because let's say you're a clean freak and you clean with chlorine bleach every single day. Well, chlorine is the biggest endocrine disruptor there is, so that can really wreak havoc on your thyroid. So maybe finding some vinegar and essential oils to clean with instead of using chlorine, for example.
Yes, yes.
So all these things are talked about to get the patient back to better health. And of course, with the guidance of their doctor, because many of these patients still need those pharmaceuticals to help them live a better life.
How well do they work in conjunction with one another? Because we know that the power of these natural medicines is very strong and can often be counterproductive with conventional medicine.
Sure, I mean, it depends what it is. It depends what it is. And this is where teamwork comes along,
yes.
like consulting the naturopath and saying, this herbal remedy that you gave my patient, is there anything I should be wary of when I'm giving them what foods to eat? The same thing if they're working with a medical doctor. The medical doctor is telling the naturopath, listen, I'm giving this. Make
yes.
sure you don't give any natural things that interfere with that. So this is where teamwork comes into play.
Right.
And I think it's something we need to work on inside
Definitely, definitely. You haven't mentioned fruit with this
fruit
diet.
you're fine. Yes, fruit you can eat.
All fruit?
All fruit you can eat, unless it's like the goji berries that I mentioned, that are the nightshades.
What is not good about goji berries?
It's not that they're not good. They stimulate the immune system. So, like, if you're stimulating the immune system in somebody that has, is in full autoimmune flare-up, it can cause more of an attack. So you just exclude them for now until we see that there's an improvement in gut health.
Does this mean that wine, chocolate, and beer is totally off the spectrum?
Well, yeah, alcohol, what we see in a lot of these patients that have autoimmune disease is an inability to detoxify properly. And since alcohol is mostly processed in the liver, we don't want to give the liver more of a chance to work hard in terms of becoming sluggish. So yeah, alcohol is off the table. Chocolate, the cocoa bean is actually a bean, so it's excluded in the first phase of the AIP. Later on, it's completely okay.
Only the one that's terribly bitter and not so nice, 75% cocoa.
Oh, the dark chocolate, yeah.
Yes, very dark chocolate.
Yeah, I mean, for some people they can do fine on an organic dairy chocolate. It's fine. It depends. It depends on the person.
Right. Water, apparently, the body comprises. Tell me exactly the
about
percentage.
70%.
70. Okay.
Yeah.
Can actually be harmful if one drinks too much water. I read that as well. How much truth is there to that?
There's truth in it if you're gulping down water during a meal. Okay, if you're just sipping on it during a meal, it's fine. Gulping down on it, especially on patients that we talked about that have Hashimoto's, don't have enough stomach acid to
Yes.
break down their food. If you're gulping down water and you already have low stomach acid, you're just diluting it even further hindering the digestion process. So what I typically tell people is make sure to drink all your water outside of your meals, like, an hour before or 2 hours after a meal.
What happens for people who are drinking glass of wine, for example, with their meal?
Well, again, that wine, any kind of alcohol is hindering the liver to detoxify properly. And especially people that have autoimmune disease, you'll find that they're the most sensitive to alcohol. Even half a glass of wine can cause them to not feel well for the next 3 days.
Nuts?
Nuts, again, nuts and seeds are excluded in the first phase of the AIP diet protocol, and then we start reintroducing them. And for most people, besides peanuts, they don't see a problem with eating them.
Right. What about the difference between the paleo diet and keto?
Okay. The keto diet the paleo diet is higher in protein, where the keto diet is much higher in fat. Okay, and both are very low in carbohydrate. The keto is even lower in carbohydrate, so you're talking about less than 25 grams of carbohydrate in your diet every day. And again, it's not for everybody. We use it on. There's been a lot of research coming out lately for people that have brain issues like Alzheimer's and mental health issues or degenerative brain issues.
Yes.
Where the keto diet, because our brain is mostly made of a lot of fat.
Yes.
So by kind of supplying it with the right nutrients of fat and a lot less carbohydrate, we can actually see reversal of a lot of symptoms, or even just stop the progression altogether. And so the keto diet has been seen to work in those patients. A lot of people have been using it to lose weight, but again, doesn't work for everybody. Especially if you're extremely stressed out. Having low amounts of carbohydrate is just not a good idea. It can really drive you into insanity if you're not eating enough carbohydrate.
Arthritis. We've had a question about that. Is there anything, just to clarify the difference between rheumatoid and osteoarthritis, and what sort of diets you'd recommend?
I mean, both are kind of related. We both see like similar symptoms both in osteoarthritis and in rheumatoid arthritis. One more on the nerves and the other more in the bones.
Yes.
And any kind of joint pain or arthritic pain in the joints.
Yes.
A lot of the time, if I exclude gluten completely from the diet, we see a vast improvement in symptoms. And that's because
you've reduced the inflammation.
Yes.
So you would typically recommend that somebody with arthritis is going to go gluten, dairy, and sugar-free.
Yes.
For a period of 6 weeks.
Mm-hmm. Yeah, and then we start reintroducing from there. We take it from there, and depending on like what's going on with the client. So, for example, a lot of people I see with migraines.
Yes.
Migraines for years, and all this medication that they're taking to get rid of their migraines. When I get rid of gluten and give them magnesium supplement, they're like, I haven't had a migraine since I last saw you, which was a month ago.
Is magnesium helpful for arthritis?
Can be. You want to think of magnesium as your anti-anxiety mineral. So any kind of tension, any kind of cramping, like a headache or your muscles ache, or you're very stressed out, magnesium helps to alleviate that.
I see also quite different dosages, from 250 grams right up to 1,000. Does that depend on the person?
Yes.
And does more mean it's better?
Not necessarily.
Not
Not necessarily. It depends on the person. I'll usually start them off at about 300, and if they need more, like for example, people that are severely constipated, if I give them a version of magnesium called magnesium citrate,
yes,
that can help them to start going to the toilet better. So we can dose all the way up to 1,200. So if 300 isn't working, then I'll tell them, okay, let's do 400. If 400 isn't working, and we just keep going up until we hit a sweet spot where they're going to the toilet every day without an issue.
Could that also be in reverse, that maybe they're having too much, and then they're
if you have
too frequently?
Yeah, if you have too much, one of the signs of having too much magnesium is diarrhea all the time. Yeah, so if, for example, I'm dosing up and the person at 700 starts having diarrhea, then I'll say, all right, 600 is your dose.
And how long is that before you see these effects?
Again, you can see them pretty quickly, like within 2-3 weeks, you can start seeing the bowels.
Is that quick?
Yeah, I would think so. I would think so, yeah, because I mean, if you think about, for example, the example I always give is that in order for us to produce a baby, our body takes 9 months, doesn't it?
Yes.
Takes 9 months for whatever reason.
I'm concerned with diet being recommended as a cure for cancer. I actually Googled it, and it was frightening to see drink green tea, take turmeric, and then you have an anti-cancer diet by sipping green tea throughout the day. You must eat garlic, fish, you must snack on grapes. And I'm thinking, for someone who's desperate, and they start to do this, and they don't follow their doctors anymore, they stop chemo, where are they?
Right. I mean, cancer is definitely not my area of expertise, but what I do know is that we should always get an integrative approach. So diet is very important. It's a very important part of getting better with cancer, and doctors should recognize this too. Doctors shouldn't just be like, "Oh, forget it. It's not. It doesn't matter. Eat what you want." Because I hear a lot of doctors.
I was going to say,
too.
do you hear that a lot? And how progressed and progressive are doctors in Cyprus with regard to diet?
Well, in terms of like the doctors that I have dealt with in terms of endocrinologists, some are on board, some are like, oh, this stuff is just,
hocus pocus.
Hocus pocus from America, But, if you're looking at the research, if you're looking at the science, there is a place for diet, and there's a very strong and powerful place for diet, and ignoring that is just silly, in my opinion. So if you're a cancer patient and you are having chemotherapy, my biggest thing to say is that yes, work with your doctor, but also work with a nutritionist that knows about a cancer diet and to make it individualized for you. Everything is needed during that time.
I think that you've hit the nail on the head with the individualized. Too often we just hear one general diet, and obviously it's extremely specialized. It depends on everybody's history, and I think that needs to be reiterated, what you said in the beginning of the program, to take a history and to see when you were born, what are the triggers, what's happened in your life, and that may build a clearer picture.
Yeah, exactly. And to also work with the patient in terms of, like, a lot of people have issues with emotional eating. I'm guilty of that in the past. So when I'm bored, I'll eat. When I was frustrated or sad, I would eat. And dealing with those issues too, and learning new ways of reprogramming your brain to look at food as something that's nourishing you rather than something that's punishing you, is very important as well.
Finally, I'd also like to just touch on diet and diabetes and what's happening to our children in the schools. We recently had a report from the education department that the contents and the food being sold in the school tuck shops and the school canteens was of insufficient quality, not the correct foods, sandwiches were not properly made. How, I don't understand how that happened in the first case, and what can be done to fix it. For example, where are the fresh fruits? At one stage they were there.
Right. I mean, this is something that I feel very passionate about at the moment, because I have an 8-year-old daughter in the school system that is exposed to the cantina.
Yes.
And it's really sad. I mean, I've approached people to kind of start talking about it, and they just look at me like, oh, you know, you're causing your daughter psychological problems by not allowing her to eat this food every day. And I'm like, first of all, it's not food.
Yes.
It's poison. Mm-hmm. Second of all, it astounds me what a lack of education there is amongst our public. For example, people were telling me, oh, but they're okay to sell Cheetos because those Cheetos are very high in fiber.
Oh, okay.
So I think there's a disconnect between how food is really affecting our children's health, because we're allowing our children to say, well, it's okay, give them that food for sake of not pressurizing them psychologically.
It's much more difficult to say no.
Yeah. Whereas if you, in the cantina, if you put choices that every child will love to eat, I'll give you an example.
Yes.
I made kale chips for my daughter. Very easy. You take kale, you rip it up, you wash it, you put a little bit of olive oil and a little bit of salt, and you stick it in the oven for 20 minutes. Done.
I was always wondering how those were done. I'll try those, because I actually do have kale.
Yeah.
But I didn't particularly like the taste. But the chips are good.
The chips are very nice.
Yes.
My child took it to school, and the kids loved them. They absolutely loved them. Now they're getting greens. They're getting real food inside of them. So it's working together with people in the cantina to provide these choices instead of just the processed stuff that does no good for anybody. We are number 2 in obesity in Europe as our kids, you know, behind the UK, and that is so sad since we have the Mediterranean diet here.
That was another issue, and a very high rate of diabetes, particularly
and insulin resistance. Mm-hmm. Yeah, it's the phenomenon is just going, because a lecturer of mine, or a mentor of mine, she basically said, stay away from a lot of white and brown foods. And what are our kids eating a lot of? White and brown food. Go back to color. Put color back in their plates every single day. And, you know, if all the kids got into a mindset of, yay, I'm eating healthy, you get them involved in the process. You have cooking classes and workshops in the schools for the parents and for the children, for them to create their own foods. All of a sudden, the mentality around the whole subject changes, and you're not pressurizing your child to eat healthy. You're nurturing them to eat healthy.
It's a whole other subject. I hope that you'll accept my invitation to come back and discuss children and how we're going to transform the school canteens. I think that'll be for the beginning of September.
I would love to.
With the relevant people from the Ministry of Education, if they accept my invitation. I keep trying. I will continue. Tina, it's been a privilege and an honor to have you here in the studio. Thank you so much for discussing this very complex subject, which you've actually made very easy, and I hope that people will be in touch with you and fix up whatever's bothering them.
Thank you very much, Saskia. I really appreciate it.
Thank you. Thank you. And just mention your website, please, so that people can actually be in touch.
Sure. It's thethyroiddietician.com, and you can also find me at the Thyroid Dietitian on Facebook and on Instagram.
Thyroid Dietitian. Very easy to remember. That comes up straight away on Google. Thank you again, Tina Spirum. 26 minutes past 1. A reminder, this is a RIK Classic, and Tina loves Mozart and she loves opera, so this is for you, an excerpt from the Magic Flute.